Staying up to date on all of the news and trends in pop culture like movies, music, fashion, social media can be a chore. Well, staying up to date on all the latest information in healthcare can be a job as well. For that reason, healthcare professionals in the US are required to stay current with knowledge in their field by earning a certain number of hours of continuing education every 1 to 2 years, and that depends on the state that you practice in. Depending on the field of healthcare you in, you may also have more specific requirements. For example, certain states also have requirements for dentists about the topics we need to review in those continuing education classes, which might include domestic violence, opioids, medical emergencies, patient privacy, for examples. We also have requirements on how many of those hours of continuing education have to be spent in person at a location where there's a human being giving a lecture versus just taking those classes online. And since I just got back from the Hinman Dental meeting, that's what I'm briefly discussing today. And really quick, if you're not a dentist, I know this might not be very interesting for you, but before you leave, please chomp down on that like button and/or check out this video on tips to make your next dental visit easier. If this is your first time here, welcome. I'm Dr. Ryan. My goal with this channel is to improve communication between patients and their dentists. And yeah, you may have noticed today's topic is a bit more geared towards dentists, especially new dentists and those considering entering their profession. I plan on doing this every so often in order to help out people just joining the profession. Okay, for those of you who have stuck around, thank you. I will try to make this video rather quick. I just want to give you some of my feelings about the benefits of attending a dental meeting in person. I feel like these meetings have tremendous advantages besides just getting your CE requirements. And yes, these are just my personal opinions. There's not any scientific evidence that I'm providing for you today. If you know of any, feel free to put it in the comments down below. I'd appreciate that. So the first benefit I would say I get from attending a dental seminar in person, especially one of these larger meetings, is I feel more engaged with the material. It's really easy when you're taking an online course. It's kind of easy to get distracted by anything else going on, maybe in your house or in your environment. You might be tempted to pull out your phone, check messages or emails or something like that. I think when you're in person at a meeting, it's a lot easier to stay focused on the topic, on the speaker, and feel like you're more engaged with the conversation. That's me, but I think that's one definite benefit that I get from going in person to a meeting. Second benefit I see from attending a meeting in person is that you can also go down to the showroom floor where all the exhibitors are. For those of you who have not been to a large dental meeting before, there's usually an area where dental manufacturers or dental product companies will bring some of their latest products, their goods, and they'll have them there for you to look at and touch in person and see how they work. You can also talk to the sales representative, and they have great information for you about the product, what kind of things you can expect from it, and just get lots of good information from them. I personally had a great experience at the Hinman Dental meeting talking to the representative for a scanner that I'm looking at getting, which actually might be kind of cool to make a video on that once I actually get it set up in the office. But they were tremendously helpful. I appreciated the help that I got from that sales representative. But anyway, yeah, if you don't go to a meeting in person, then you don't have that advantage. And if you go to a larger dental meeting, such as the Hinman, such as the ADA meeting, which they actually now call SmileCon, some of those larger meetings, the AGD meeting, the national meeting, some of those have a larger number of manufacturers and product companies that will attend, and you can really find out what seems to work best for you and your treatment philosophy for patients. So that was tip number 2. Tip number 3, you can also check out different dental topics that maybe you wouldn't spend your time on hearing about otherwise. For example, maybe some topics that either were not covered well in dental school, like treating TMD, which for those of you who don't know is temporomandibular disorder. There's no such thing as, TMJ is not a disorder. TMJ is the name of a part of your body. It's a huge pet peeve of mine when people have a problem with their jaw and they call it TMJ, because that is just like saying you have knee. My fellow dentists know this. I try to educate patients about this. And yeah, I definitely have plans to make a whole video about that. But anyway, so you could see topics that maybe weren't covered very well in dental school, such as TMD disorders and how to treat a variety of them, and may also include sleep apnea, which is not discussed very well in dental school. So you could get introductory courses to things like that. And then depending on what you learn about, you might decide to take more detailed courses at universities or other facilities. So those are great things. Other topics you might be open to exposing yourself to would be topics that could be considered controversial in dentistry. And yeah, there are some of those out there. If you're not a dentist, yeah, there's some things you can bring up in a room full of dentists and cause a lot of arguments. And getting exposure to topics like that at a larger meeting helps you understand the thought processes that other practitioners are going through when they have one opinion versus another. And so you can think about it yourself, process it, explore that type of research and the conversation around that issue. Things that I would put in this category would be things like occlusal equilibration, things like discussions about extracting premolars for orthodontic treatment versus doing arch expansion at a young age. And included in that conversation would be addressing tongue tie at a very young age, which actually addressing tongue tie at a young age is not terribly controversial anymore, although I don't know that a lot of people are screening for it effectively, especially in hospitals in OBGYN wards. Anyway, that's a whole different topic as well. Lots of stuff that I kind of thought about while I was at the meeting this weekend. Okay, topic number 4, which is obvious to the extroverts that might be watching this, but maybe a difficult thing to hear for us introverts, but networking is also a huge benefit of attending these meetings in person. I myself am rather introverted. Weirdly enough, I'm putting videos online on the internet, but being an introvert is a challenge, and sometimes I need to hear that networking is important to do these things. I do enjoy talking to the sales reps, like I said, have great relationships with a lot of the sales reps that I work with, and I don't often see the specialists at some of these larger meetings, but if you're in an area where you have a study club, that's a phenomenal way to network as well and get more involved with the specialists in your community, make relationships that way. So those are great things to do as well. Even if you're not attending the larger meetings, that's a great thing to do as well. So those are really my big takeaways from attending the Hinman Dental meeting and the advantages that I saw in going. Thank you so much, especially if you watch this entire video. If you want to comment on your experiences at a dental meeting or even in your community study clubs, please leave a comment down below. And be sure to check out this video where I give tips to new dentists on how to make appointments easier for patients. And also be sure to subscribe so you don't miss out on more dental tips and news. And finally, please remember, smiles are contagious.